Morning, everyone. This is Dan Hushin. I'm with DXC Technology, and I'm leading today's DXC Tech Talk. This is the first in our industry series, where we're really kind of investigating how these digital technologies, digital cultures, digital disruptions are impacting, specific industries, especially those industries where information and knowledge are becoming exploitable by digital tools and changing the very face of how care is being delivered, how pathways are constructed, how diagnosis occurs, how patient engagement improves outcomes. And I'm really excited to have some very esteemed guests with us today. Hey Jen, is there a slide you want to put up? Thank you. So here today we have two very esteemed guests. I have Dr. Robert Waugh. Dr. Waugh was previously the president of the AMA, but he's also our global chief medical officer and kind of a digital advocate here at DXC for digital and healthcare. Really, amazing insights in the healthcare field and how healthcare both can and likely will react to some of these changes and what some of the impediments are. So I'm really excited to have him on the call with us today. I also have a DXC fellow, Femi Ladega. He's our Chief Technology Officer for our Global Healthcare and Life Sciences business. Femi and I have been working together for about 5 years. He brings incredible insights and execution capability to really change the information backplane for healthcare so that it actually can truly be exploitable by machine learning and AI techniques, and really change the way that clinical care and labs and ancillary care and ambulatory care and et cetera, actually can be used, as well as the mass personalization, right, of care delivery all the way to the individual conversation with the patient and the provider. So I'm really excited to have two real leaders in the field. I kind of call it the yin and yang, right? Femi talks about the art of the possible, and Dr. Waugh helps us to both prioritize and align what is possible with what's realistic or what's allowed or what's the rest of the controls on that, as well as helping Femi actually open his worldview with respect to the really big challenges that he's seeing in the medical field. So I'm really excited. What we're going to do today is fundamentally run a 30-minute or so, plus or minus, maybe a little bit short today because we got started late. My apologies. Kind of roundtable session, and then we are going to move over to our social media platform to actually drive an in-depth conversation. This platform is wide open to the world. It's a public environment. It's crowdchat.net/DXCTechTalk. Unfortunately, that hyperlink is no longer a permalink, and so you may very well have to search for DXC Technology on Twitter or on LinkedIn in order to get the appropriate link into the crowd chat today. My apologies, we'll have it fixed for next time. But please do feel free to submit your questions for the speakers on that site. We'll be watching that site and we'll bring the questions forward. But also to join us afterwards to really talk intimately about how and why and where and why not these technologies can be applied in healthcare. So really excited to have everyone with us today. So with that, I'm going to kind of dig into it. I'm going to kind of ask our guests to do one thing, which is to introduce themselves real quickly and a little bit of their background, and then kind of their key point of view, right, that they're bringing from this digital disruption that is happening in this cloud world, which is around automation and intelligence and the application at mass scale. So who wants to go first? Femi, Dr. Waugh?
Dan, this is Robert. I'm happy to start.
Thank you.
Good morning, everyone. I'm Robert Waugh. I'm a reproductive endocrinologist, which means I do infertility, hormonal disorders in women, microsurgery as my clinical work. But in technology, it's my feeling that the role of technology is to provide better information for better decisions so that all of us in healthcare will make a better decision, whether it be patients, doctors, hospitals, clinics, or governments or payers. And it's the role of technology to deliver the right information to the right place at the right time for the right person. And that's why I'm really excited. Now that we have much more fluid use of information, we can start using it to provide better decision making for all of us. And I think that's where we're pretty excited here at DXC. And working with Femi, he helps me figure out how to deliver the right information to the right person at the right time. So I'm really excited to be here and look forward to the conversation. Thanks.
Thank you very much, Dr. Waugh. Femi?
Hey, thanks, Rob, and thanks, Dan. Yes, I'm really excited about one thing actually in our industry today. Everywhere I go, it's about how do you present information to me in context, information that is captured before I present to the physician, and also the next, and how do you automate the next step? And for me, it kind of comes down to two things really. It's about how do you make information so liquid within the ecosystem that irrespective of where you're receiving care, the appropriate information is presented in context to the persona that you're engaged with. And you're going to hear us talking about how do you then use that insight to automate care delivery, and also to drive innovation across at the edge, and also within those ecosystems as well. And I think there's one thing Rob tells me, or Dr. Waugh tells me all the time, that imagine healthcare that is designed for performance and staying healthy. But what are the key things that you need to actually enable that? And I'll be talking about some of the what we see in the industry, what we're doing, and also what our clients are asking of us.
Awesome, Femi. Thank you. Well, let's get into it. You know, you guys are doing some amazing things right now. You know, there are kind of three layers, I really think, of kind of digital, and I think a lot of us use the front end of digital, which is the specific client experience, but there's also the mid-office and back-office experience. How do we actually allow the information economy in healthcare, right, to grow and thrive, to put information in the right place at the right time? Right. Personally, I've seen some very poor specifications built for information exchange. You know, in the U.S., they were the HITSP capabilities. You know, patient identify the patient, figure out what documents you have around a patient. Right. It's very fragile and very brittle because it fundamentally was kind of built for what I'll call episodic care versus what I'll call kind of continuous care. And so what are you guys seeing in those different zones of of interaction of information, and where are some of the bottlenecks or constraints or roadblocks, right, that are in front of you guys, and what have you done thus far to kind of move around or move through some of them? So, you know, Femi, you want to talk a little bit about Open Health Connect?
Let me kind of build the cat on that. So I guess as you have seen in our industry in the past, like you said, there was a lot of focus on health information exchanges. They were just pure repository for data. And then we moved into the meaningful use around that opened up the aperture slightly to enable information exchange and meaningful capture of structured data. And then we saw an explosion around population health management because we're all concerned about the cost of delivering care to population. Now we're seeing the next wave around precision medicine. The reality is across those four waves, there's been the consistent theme. Once you capture the data, often you expect the next step to understand the context of the data that was captured. And then you've seen that there's a lot of interoperability requirements around functional integration. And I think that's where the industry is really challenged today. We've seen data integration evolved into functional integration. And I think there are two major steps that are required today. And that's what is fueling the demands around platform economy, and that is driving semantic interoperability of data, ensuring that you maintain consistent meaning of data across functional boundaries, system boundaries, organizational boundaries, leading to the real McCoy I would call process interoperability. Now, the industry today, to a large degree, is kind of stops very much at the edge of the second step. And we believe that in order to deliver the transformation that is expected in healthcare, not only do you need to optimize the last mile in terms of data acquisition, You also need to optimize the insight delivery back to the persona that consumes that insight. And that allows us really to take advantage of AI and machine learning to develop different wide-angle views that enables you to understand, okay, this guy has this condition. What are the real-world evidence out there that can be contextualized back into the workflow of the physician? And those are the real things really that we're really focusing on, shortening the distance in terms of data acquisition, but also shortening the distance in terms of insight delivery back to the persona that needs it.
Yeah, Dan, I'll take a slightly different direction on this as well. Femi talks about the technical things that we need to do to put interoperability in place. And while I believe it's very challenging technically to have interoperability in data, healthcare data, we also have to remember that there are some business impediments to interoperability that have nothing to do with the technology. And so I think we also just need to be honest about that. Clinically, it makes a lot of sense to share data about patients. But from a business sense, sometimes there are business blockers in place because the business model does not allow for interoperability or may actually find interoperability a challenge. And so hospitals that see patients as a direct source of revenue may not be too open to sharing the information about those patients because that information is stickiness that connects them to those patients who are sources of revenue. And so I just think we have to be upfront and understand those business issues as well as the technical issues that may prevent us from having interoperability. There's also some vendor issues where some of the technologies that are in the marketplace are interested in keeping everybody in the corral of that particular vendor. And they don't want to have sharing. So we talk about information blocking and other impediments to interoperability that are a significant problem today in the industry. So I just want to say that besides the technical issues of interoperability, there are business issues as well.
I think it's very real. And you know, is there anything on the regulatory side, right, that you're seeing, you know, either in the U.S. or internationally, right, that's a challenge as well?
Well, as you know, I'm the co-chair of the Health Information Technology Advisory Committee at HHS. And as a federal advisory committee, we have a lot of direction from the 21st Century Cures Act. And there's a lot of language in the 21st Century Cures Act that says, you know, they want to see the market move away from information blocking and more towards interoperability. And so we're continuously looking for ways, along with the Office of National Coordinator in Health and Human Services, on how do we facilitate the market to this more interoperable place, whether it's a mixture of self-policing within the industry or external regulation may need to be necessary as well.
Yeah. So, you know, common, you know, set of common themes that I hear across multiple industries, right? One is my legacy providers, right, are in defense mode, right, and trying to fortify, right, their position and maintain a couple more years of stickiness before they get disrupted, right? And they act as a blocker to the information engineering and information streams that are potentially valuable to other participants in the health ecosystem or to the broader ecosystem, right? You know, the second piece is fundamentally figuring out how to build those information ecosystems in a way in which there's an appropriate level of neutrality so that more people will play and that the patient or the consumer, right, is in control of their information in that landscape. And then, you know, the last one that we haven't talked about a little bit is kind of cognitive and AI, right, and its implications and where kind of we are. So, you know, we've seen, you know, a couple of AI and cognitive, you know, things in healthcare, right? We've heard numbers coming out, right, around how, you know, physicians may very well have, you know, digital assistants, right, that are cognitive, that actually assist them in the diagnosis and pathway design for individual patients. What are you guys seeing in that AI and cognitive space? What are you most excited about? Can you point to any things that either, you know, DXC or DXC with its partners have done in the marketplace?
Yeah, I can talk a little bit about that, Dan. Just to kind of close out on the regulatory piece, I think what we're seeing right now in the marketplace is a lot of government are actually saying, we understand the power of leveraging platform economies to actually disrupt healthcare delivery, and recognize that there are security tapestry and posture you could apply now that allows you to take advantage of cloud-based services. And that lends itself actually to AI and machine learning, because there's the power you need to actually train the data, to derive insights from the data means you need high-powered computing type capability, a lot of which are not behind your firewall, but out there on the cloud services. So what we're seeing organizations actually leveraging is leveraging a lot of AI and machine learning capabilities to actually do what I call prospective analytics. So looking at patterns and using those patterns to understand what could occur, and then creating interventions along those lines. So a good example, one of the things that we've done with a number of clients is looking at individuals that have, say, diabetes today or a chronic disease, and figure out, can we use this profile to understand what are patients that we've got within our portfolio that are yet to be converted or being diabetic, but use that to identify them and then create prospective wellness programs for such individuals. So that is something that we're seeing a lot today, and a lot of our partners are working with us along those lines, cloud-based AI solutions, but also having a lot of those platform solutions as well behind the firewall in their data center. The point there really is we now have the opportunity to bring real-world data and real-world evidence, and I would extend that to what I call real-world insights to close that loop. That is real today, and a lot of that we're doing today with a number of our clients, yes.
Absolutely. So, be remiss not to say that, DXC, right, is strongly partnered with the National Health Service in the UK, right? And we've moved from basic clinical health management, right, in the acute and ambulatory care environments, right, to this population-based health model and chronic disease management. With NHS in the lead, as we've been trying to really shift the outcome. A little bit unique in the UK because we've got a kind of single payer system, which creates a certain opportunity to drive an ecosystem effect that may not be possible right here in the US or elsewhere. But FEMI is right on the cusp and probably has some use cases that are pretty interesting around some chronic diseases that we're beginning to change the trajectory of, at least for the patient's well-being. Right, change the trajectory. The time that they spend in readmission, the overall wellness that they provide. So it's remarkable. Dr. Waugh, anything on the AI and machine learning front, right, that you're seeing out there that you're really excited about? Maybe it's the new wearables and their ability to provide interesting information. I don't know.
Yeah, a couple things. First, the American Medical Association just recently wrote a paper about AI. And one of the things that I think is important to highlight from that is we think the term ought to be augmented intelligence, not artificial intelligence. We, again, go back to what I said before. We need to find ways to use technology to help us take better care of patients. Yeah. And most of what we've seen so far has been in the area of image recognition and image analysis. So there's been a lot of work done on that because you can take a lot of images, train up machine learning, and then use that training to then apply it to new images. So that's a lot of what's been done, but it's been branching out into other areas of healthcare, as Femi talked about. How can we use this augmented tool to help us with chronic disease management, either in management of chronic diseases or prevention, identification and prevention of people who might get that. Yeah. There's a small project that we're doing in Singapore that's pretty interesting where there's a symptom called flat feet in Asia that's very common. And it's a common problem and requires a certain amount of observation to diagnose. And so we're currently training a machine learning apparatus of images of normal feet and abnormal feet. And once that's done, we're going to apply that to an application to allow patients at home to take pictures of their feet and then have them analyzed through the algorithms that are already taught by the known images. And this will allow us to do massive screening of people's feet without them having to come into the clinic or office. And that'll allow us to figure out who needs attention and who doesn't need attention. Yeah. Much of what we're looking at in healthcare is figuring out who do we need to focus on, because there's a whole bunch of people out there and we don't need to look at every person in high detail. And so we want to utilize our resources as effectively and efficiently as possible to figure out who do we need to really focus on. And that gets us into another area, what I call the consumerization of healthcare, where we need to learn from other industries about how we get a broader picture of our patients, rather than just a particular disease process or a gender or some other category. We need to have a holistic picture of our patients, and we need to have more detail. And I think the technology can start doing that. Just like the retail sector knows a lot about our buying habits, I always say, wouldn't it be great if I knew as much about my diabetics and my hypertensives as the retail industry knows about my wife's shopping habits online? Because that would be so helpful for me to figure out, again, who I need to pay attention to, who I need to put in a preventative process to keep them healthy or manage them once they've already got a chronic disease. And I think that's going to happen with things like CRM technology. That's been big in the retail industry. As you know, we recently purchased a CRM implementer, a real magician with the Microsoft Dynamics TriBridge, and they've built a product called Health 360, which gives us the ability to have a very broad view of patients and put that broad view into place where we figure out what the right next thing to do for that patient is. And the right next thing can then be delivered by somebody besides a doctor or a nurse. And so there can be much more frequent interaction between the system and the patients than just them coming in to see the doctor 3 times a year. So I'm really excited about this consumerization that we're seeing in healthcare, along with the data fluidity that FEMI has made possible with things like Open Health Connect.
Yeah, I mean, we talk about access a lot, and we talk about physician shortages, and we know, that there are certain places in the world where that's really exacerbated. So, I think that ability to gain access, right, and to then, prioritize, right, what you might call more intimate care, right, becomes really interesting, especially if you can identify those cases early before they become too costly to remedy. So I think that whole model of, being able to start early with wellness programs, right, quickly identify things that it could be chronic, right, prevent them from being chronic, all of these things start to really, in my view, I mean, I've heard lots of people talk about bending the curve in medicine, right, and I really do believe that, we're on the cusp of really a technology basis and approach to do so.
I mean, I can just add one more thing, Dan, if I may. I think first of all, and Rob has just talked about, what Dr. West talked about, I think we're beginning to see that in the past, I mean, most electronic medical record systems have clinical decision support system that tells them what treatment or what interventions they got to undertake for a given individual. What we're beginning to see right now is busting away from that allows you to begin to create a massive ecosystem effect on data across the entire care continuum. Now, why is this important? We believe that often I may present myself in front of Dr. Ward that I've got this condition, but the reality is based on my symptoms, based on my physiological thing, based on the digital me around myself, it might be able to signpost me to the best treatment location rather than coming into the walls of the hospital. And I think for me, if there's one thing that we're trying to reinforce in the paper, it's pretty much around the mass customization of data. And how do you now leverage that using platform economies of today to actually begin to bend the cost curve of healthcare? And I think that for me is almost like doctors talk about shared accountability. So me and my doctor are responsible for my outcome. But guess what? There's a digital me, there's a physical me, right? And there's a potentially 21st century digital me. Now, how do you mesh all of that together in a way that that information is shared in a secure way across the ecosystem? And that for me really is the thrust of healthcare today.
Dan, we may have lost your audio.
Sorry. So that's amazing, right? We've heard this analog, right, all over the place in our industries, right? The digital twin, right? So how do we affect these digital twins, where we convert, right, the atoms to bits economy, right, with increasing levels of fidelity and completeness, right, to take on new opportunities, right, for cohort analysis and other elements, right? People have a limited number of dimensions over which they can optimize, but computers really have a nearly infinite number of optimization dimensions depending on your time and the time you're willing to allow on the problem. It really does, afford us some new opportunities. To maybe go back to that classical debate, right, of, is it your genes or is it your environment? But it's going to be interesting to watch along the way how that plays off. I really do want to thank our guests. They're incredibly rich in conversation, in knowledge, and I wish this conversation could go on for hours, because I've done it for hours with them, and they're remarkably well versed in all the different dimensions that are going on. I would suggest that on our DXC website we do have our DXC Health and Life Sciences Horizon paper, which is a technical piece, which is looking at the trends over the next 2 to 3 years, right, that we're going to try to take advantage of in terms of changing healthcare. And these are two of the authors of that paper, so I'd be remiss not to give them a massive amount of kudos for that work. And we do explain a lot of what we talked about today.
It's mainly technical, but there's a little clinical in there too.
All right, there is clinical in there, Dr. Waugh. You did a good job. But it is a bit technical, and I actually believe that it is a yin and yang, right? I mean, the technologies are coming up to speed, and we're figuring out how to use them and what they're good for and what they're not, and if they're not, what that facet is that we need to change to help them be good there. At the same time, right, we have a clinical environment in which we have to selectively choose our battles as well, because there just isn't enough time. And I talk, so I'm going to wrap up with one of the coolest things that I saw. I saw it about 3 months ago. Right, it was a digital pathology center that could actually train computer vision to read a slide for cancer in seconds, as opposed to having to send it out to be stained, which actually made it viable within a operating room scenario. And I thought that was a remarkable use of technology, where digital pathology is becoming more and more of a problem, especially in developing worlds, where radiology, pathology, and these other ologies could have trained experts right at the location where the patient and primary care physician are, that could help them make better decisions around these chronic conditions. So that was one of the ones that I saw that was absolutely amazing, and really I thought could change treatment pathways and outcomes for patients. So that was mine. But with that, I'm gonna send us all off to the crowd chat. So, hey, Jen, if you can put that last slide up, we'll send everyone on the right direction. Oh, maybe Hajian's gone. So, if you haven't seen the link for the DXC crowd chat, we're going to keep this open for about 30 minutes, more if the conversation's great. We have a replay for today, right, at DXC Technology / DXCTechTalk. The common hashtag is going to be DXCTechTalk. So if you want to find where that conversation is and click on the hyperlink from the Twitter feed, you can do that there. And the paper that I was talking about is available at DXC Technology / Digital Directions. So thank you guys very much for tuning in today. We really appreciate it. We're going to do the next industry in a couple weeks, and really excited, right, to have Dr. Waugh and Femi both part of DXC, but also helping to really lead in the industry around how technology can change the face of healthcare and wellness for individuals globally. So thank you guys very much for your time today.
Thanks, Dan. Good to be with you. See you all over in the crowd chat.
Absolutely. Take care, guys.
Yeah.